other aspects, the childcare and the surgeries. So what are the challenges over here? Right now, the most important thing is the tracking of the whole aspect, that is specialized tracking for newborns and surgery events, and also the manual billing gaps, which you saw earlier as well. What we propose is basically when there is especially in the pediatric department, when there is a newborn child there is a birth of a newborn. So we start the tracking mechanism over there. So right from there, along with the mother's details, we put out the newborn's details. We put out, because there will be a lot of tests, there will be a lot of procedures that has to be done. The checklists have to be prepared. And then with each and every test, we also update the records, and we keep maintaining the whole this thing, that is the progress of the child. That is, they might continue with the same hospital, so that the complete record is available with us, starting from its birth to so far, whatever the test that has been done, the vaccines that has been provided, and all these aspects. And then for the surgeries, we can also put out in such a way that if a surgery has to be put out, it could be for a regular patient, or even could be for infants or any child for that matter. So the surgeries can be put out in the appointment module, basically who is a surgeon, and basically when it has to be done, for how much time it has to be done, and then what are the checklist for any particular surgery. That is, we need blood banks. It requires so much of blood to be replaced, or other tools to be put out, other equipments, and also the medications. All these things can be put out over there, kept ready. And most importantly, once the surgery takes place, the post-op notes, that is what all happened, the doctor writes a very detailed report, and that can be made available in the digitized format in the system itself. And finally, that goes for the billing. All these things again can be done within a tool itself, which is Odoo. So as I said, all the tracking system of the surgery, from the scheduling to the outcome, and overall can be put out in such a way that it's going to be a one-click invoicing system. Either could be for pediatric, also for the this thing, that is basically for surgeries. You can see one dashboard over here where we have put out for childcare. This is again a newborn info, where who is the mother, what's the newborn ID. We provide an ID for it. We can give a name for it, and all the details of its the hospital details, or most importantly, the healthcare details can be put out over here, which any pediatrician will record. And then we can continue this so that it becomes a digitized record and available for any time. That is basically analysis and for diagnosis.